Tracy Parantala has worked for UMC for 20 years, and with many of those years being spent right there in the ICU. And this certainly cannot be an easy job in the trauma ICU. What does Tracy bring to the job that makes her so deserving of the Nevada Hospital Association Direct Patient Care Nurse of the Year for 2023?
Well, Tracy has incredibly high standards of care. She has very good critical thinking. She listens really well to patients and their families, their friends. She interacts with pretty much anyone on the interdisciplinary team, whether it's anywhere from like outside facilities like Metro or Coroner, all the way to like speech therapy, occupational therapy, all the trauma surgeons and the various consults. She can navigate problems. She can make sure that the patient is getting what they want. The families and the patients adore her because she is also quite humorous. She works really hard for the patients, and even in conflict, which happens a lot in our population of patients, and there's lots of things that are happening, she handles it really well and is able to de-escalate situations and can always listen and be present in every moment. And she has very good outcomes with that. Like, she's really great at that. She's an excellent nurse. So there are a lot of patients that come in, and of course not all of them can talk depending on their injuries and all of that. And then you have their families. Lots of times you have wives whose husbands are injured and nobody's been doing any of the financial stuff except for the husband that's now injured, or there's kids, or they were estranged from someone and now they're getting a call. There's all these issues that impact them in addition to the trauma, that they're overwhelmed. And so often the families can be super angry, not at anyone in particular, but just at the situation, the complete lack of control. And Tracy is very good at helping them break down what they need, helping them take breaks, helping, give them things that they can do. So even when it's a patient that is very sick, like, we teach them often how to do range of motion on parts that they can, so that the family has some type of feeling like they're contributing to them getting better and that they have some type of control and information. She breaks doctors' information down like nobody I've ever seen, so that everyone can understand. And even if they ask the same question over and over and over again, which happens a lot, because in that kind of situation, you can only take in so much information. She's super patient.
Can you expand on how Tracy improves the quality of care for her patients and how that impacts the employees around her?
We get all of our patients up in trauma ICU, ventilated or not. Sometimes we will even wheel them outside if we can safely, just to get a new environment, to get them mobilizing. And she emulates that all the time. And that is the expectation, that you do that. And newer nurses especially see her and they want to be like her. And so they want to keep doing the things she does. And she will break things down for them and explain why. Why we do this, why we do that. And so she improves a lot of patient care.
Having a positive attitude, we all know that this can be infectious. And in your nomination, you mentioned that Tracy is always coming to work with a smile on her face. How does that attitude benefit the staff?
You have to remember, in that unit, your day is never as bad as that patient's laying in that bed. And if you can just remember that, and you can have a charge nurse that emulates that for everyone. And even when they're having time, she will go in there and say, hey, well, why don't you take a break? I'll take over this, so that there is that consistent good attitude, because you need to encourage that good attitude, because also those patients need that attitude, because often they're defeated because of their injuries or anything like that. So if you have a nurse that can't have a good attitude as well, it impacts your patients, So she's very good at that, and she makes a lot of jokes in trauma. And not all of our jokes are always appropriate, but we do, it's kind of your stress relief. But she is great for that. They do a lot of morale things. She has all kinds of stuff that they do in that unit. She's great. I'm really happy that she won this award. She deserves it. I often feel like she is overlooked because, you kind of get used to it, and I don't want to ever think that she is not, I don't want her to think that she's not a huge asset to our team and UMC. And often, sometimes in our busy lives, we don't get to recognize nurses for the outstanding work they do for our patient care and our center and their outcomes. And so I just want Tracy to know that we adore her and we are grateful for her every day. And I am incredibly grateful for her because she makes my job much easier as well.